Hello, everyone, and welcome to this NNLM webinar, Commercial Determinants of Health, Tobacco, um, Promoting Health Equity and Tobacco Control, the Role of Place-Based Policies with Amanda Kong, PhD, MPH. My name is April Wright, and I am the Environmental Health Program Specialist with Region 1 of the Network of the National Library of Medicine, the NNLM. Before I introduce today's presenter, I'd like to cover a few housekeeping details. Today's session is being recorded, and the recording will be available on the NNLM website in a couple of weeks. If you need captioning, captioning is, there is a link in the chat, and you should also see it in the multimedia viewer. And if you have the message that says it's an external site, just scroll down and click on continue, and you'll be able to see the captioning. Everyone has been muted, so please use the chat for comments and questions. And please be sure when you send a chat to send it to everyone. Questions for the presenter will be answered at the end of the presentation. Now, let me tell you a little bit about the network of the National Library of Medicine. The NNLM is the outreach arm of the National Library of Medicine, an institute of the National Institutes of Health. It is comprised of 7 regions, each with a regional medical library based at a university in that region. NNLM provides regional funding and national training opportunities on its mission to provide U.S. researchers, health professionals, public health workforce, educators, and the public with equal access to biomedical and health information resources and data. And you can find out more at nnlm.gov. Now, I am in Region 1, which is based at the University of Maryland, Baltimore Health Sciences and Human Services Library. Region 1 serves Delaware, Maryland, Washington, D.C., Virginia, West Virginia, North Carolina, Kentucky, Pennsylvania, and New Jersey. Now I'm pleased to introduce today's speaker, Dr. Amanda Kong. Dr. Kong is an assistant professor in the Department of Family and Preventive Medicine at the University of Oklahoma Health Sciences Center. Dr. Kong is a public health and policy researcher who seeks to understand the commercial determinants of health with a focus on the inequitable availability and marketing of unhealthy commodities, such as tobacco products. Dr. Kong employs equity-centered analyses to measure and understand how cancer-related health behaviors and outcomes are related to the social and built environments in which people live, work, and interact. Her work focuses on measuring the impact on health and equity of place-based tobacco control interventions, such as reducing tobacco retailer availability. Dr. Kong's research also critically evaluates the potential for public health policies to ameliorate or unintentionally exacerbate racial, ethnic, and socioeconomic health inequities. Please join me in welcoming Dr. Amanda Kong.
Great. Thank you so much, April, for that kind introduction. I am trying to share the slides, but it looks like I need to get permission for that.
Okay, let me make you a presenter. There are more people than there were yesterday. Okay, here we go.
All right, that looks like it worked, so I'll try this. And does this look okay to everyone? Everyone can see that?
Yes, we can see it.
Okay, great. Well, yes, thank you so much for that introduction, and I'm excited to talk with you all today and to discuss promoting health equity and tobacco control, and specifically thinking about the role of place-based policies in the neighborhoods. My acknowledgements and funding disclosures are listed here. And today I have a few different learning objectives listed. I'm going to first talk about why the tobacco retailer environment is an important point of intervention for tobacco use. I'll then present findings from a few different studies that have documented neighborhood level inequities in both the marketing and the availability of tobacco products and tobacco retailers to demonstrate why retail-focused strategies are needed to reduce tobacco use equitably. And then finally, I'll wrap up with a brief overview of some place-based policy strategies to reduce these inequities. So first, let's just talk a little bit about tobacco use in the United States and also the importance of the retail environment. So here is a figure on the side that shows adult cigarette smoking prevalence over time. And we see a large decline over several decades, and we should be celebrating this in public health. And much of this decline is attributable to what the Centers for Disease Control and Prevention, or CDC, has coined the tobacco control vaccine. And so the tobacco control vaccine is made up of 4 different population level strategies for decreasing smoking. So things like smoke-free air policies and also increasing tobacco cessation access. Despite this, tobacco use is still the leading cause of preventable death, and it's attributable to more than 480,000 deaths per year in the US alone. This is about 1,300 deaths per day. And about 14% of adults still report smoking cigarettes, although 70% report wanting to quit smoking. Tobacco use and smoking is also a cause of 1/3 of cancer deaths, and the financial and health costs are pretty enormous, estimated to be about $170 billion per year. And in 2018, I estimated that there were more than 325,000 tobacco retailers just in the US alone. And I want to try to put that number into perspective. So I think most of us would agree that McDonald's are pretty common. Retailers, they seem to be everywhere. You typically don't have to drive very far to find a McDonald's. And so here's a map of McDonald's across the US. And each of these yellow dots or gold dots represent a single location of a McDonald's restaurant. And then here's a map of tobacco retailers across the US. So we see a lot more. And when we compare the two of these maps, what we see is while we think McDonald's are everywhere, tobacco retailers are even more ubiquitous. And so what are tobacco retailers? Well, there are many different types of retailers that sell tobacco products. So we have things like our traditional tobacco or smoke shops, but we also have pharmacies that sell tobacco products. We have grocery stores that sell them. And most commonly in the US are gas and convenience stores that are selling these products. And so let's briefly talk about the commercial determinants of health. So the commercial determinants of health have been defined as strategies and approaches used by the private sector to promote products and choices that are detrimental to health. And so thinking about tobacco here, we are interested in the strategies and the approaches that are used by the tobacco industry to promote tobacco products which adversely affect the health of its consumers. And so in fact, cigarettes are the only legal consumer product that when they're used as intended will kill half of all long-term users. So the tobacco industry is also one of the only industries by US law that has to report how much money they spend on marketing. And in 2019, it was reported that the tobacco industry spends about $23 million per day on cigarette and smokeless tobacco marketing. And so this comes out to almost $1 million an hour. And so what is the industry spending this on? So almost 94% of cigarette marketing expenditures are spent on these 3 things, including price discounts that are paid to both retailers and wholesalers to try to reduce the price of cigarettes that consumers are paying for. It's also spent on promotional allowances to retailers. So actually paying retailers to stock, to shelve, to display different products and different brands of products. And then similarly, promotional allowances to cigarette wholesalers. And so what's this look like, when you're walking around? So here's a cigarette store, and we see, there's a cigarette nicely displayed in the actual branding of the store. And then we see a variety of different cartons, but also packs of tobacco products that are being sold here. And then here's a storefront where we have some nice wide open windows, but a proliferation of ads for different tobacco products all throughout. And then when you walk into a convenience store, this is something that probably most of us have seen. You go up to a register to pay for products, whether you were intending to buy tobacco products in the beginning, or if you're someone who hasn't started smoking or using tobacco products, but you're greeted with this image, which is called a power wall. And so we see a whole bunch of different variety of tobacco products being displayed and neatly arranged in packs here. And so the industry is actually, working with retailers and doing contracts with them to incentivize them and to provide these shelving units and to display the products in a specific way. And then here's an image of where we would have a kid hanging out typically, and we can see, a kid would be sitting on this, and right next to them would be different tobacco products being advertised. And then similarly, we have some tobacco products that are behind the counter here, but then, a strategically placed M&M guy with a bunch of different products that are there. And you could think, kids might be especially trying to grab these products, and then they have these tobacco products at their eye level. And then this is the final photo that I wanted to show, which is actually a stop smoking center where nicotine replacement therapy is being sold to help people quit smoking. But we see right above it and right next to it that tobacco products are being sold alongside it. And so it probably isn't surprising then that studies and reviews have found that exposure to greater point of sale marketing or retail marketing is associated with youth initiation of products, continued tobacco use and increased frequency of use, and it makes it harder to quit smoking and to stay quit. Similarly, reviews and meta-analyses have indicated that just living near a tobacco retailer or in a neighborhood with a lot of tobacco outlets is also associated with the same tobacco use behaviors among both adults and youth, and also amongst adults, some health outcomes. So now we hopefully have a stronger understanding of why the tobacco retailer environment should be an area of focus for both tobacco control and public health. So let's next move on to talking about neighborhood inequities in tobacco marketing and availability. And so before we dive into some studies, I first want to ask this question, which is, why would we expect to observe neighborhood, racial, ethnic, and socioeconomic inequities in tobacco retailer marketing and availability? So in other words, why are people separated into neighborhoods in the first place? And so structural or systemic racism and discrimination has caused different processes and policies like residential segregation, housing discrimination, and different zoning regulations. And this has led to the spatial stratification of individuals by race, by ethnicity, by socioeconomic status into specific and different neighborhoods. This then leads to social groups having differential access to both material or physical resources as well as social resources. And so you could see this being both health promoting resources. So for example, living in a neighborhood that has access to green spaces or parks, maybe living close to a chain grocery store, but it might also result in social groups having differential access to health harming resources. So in this case, thinking about tobacco retailers. And taking this all together, we then have people separated into neighborhoods as well as resources being separated into those neighborhoods. And together, this has led to racialized places and concentrated poverty. And so thinking about tobacco, this is a One Secret Tobacco Industry document that's talking about a marketing tool called the Integrated Retail Demographic Database Micro-Marketing Tool. And there are several inputs that go into this tool, but a few of them that I want to bring your attention to are highlighted here. So the industry is looking at individual sociodemographic characteristics and how these relate to tobacco product brand preferences. But they're also looking at neighborhood level census demographics, so things like income and education. And then we see they're also looking at the actual store locations, and they're examining these different characteristics of neighborhoods in addition to where these stores are located to then create something called trade areas of where a tobacco product or a specific product may sell particularly well. And so all of these inputs then result in a measure of a, quote, potential index, which again is basically a score of how well a specific tobacco product may do in a neighborhood. And so here's an actual map that was drawn by the tobacco industry, resulting from this demographic marketing tool. And so as we saw in that earlier document, one of the inputs in the marketing tool is examining the demographics of these neighborhoods to come up with a trait area. And so the industry is focused on this main center store here, and it's named the area or the geographic area around the store a mixed ethnic urban cluster average store. And the shaded dark black area is where a product may sell well, and it's deemed a high share area. And I want to note that it's not just a random circle that's drawn around the store, but it's actually a very strategically targeted area based on shared socio-demographics across space. And so the tobacco industry may actually be capitalizing off of historical and present systems of residential segregation by strategically then targeting certain products and marketing in specific neighborhoods that some individuals are then more exposed to than others. And so you could imagine then over a life course that this may help explain some of the observed population level smoking behaviors and health inequities in tobacco use and related illness that we continue to see today. So now that we've discussed the theoretical and the historical context for why we may expect to see neighborhood level inequities in both marketing and availability of tobacco products, I next want to touch on 3 studies to see what are we actually finding. So this first study I'm going to talk about today is a systematic review that examined neighborhood inequities in the retail marketing of tobacco products. And so the authors define marketing to include those tactics used by the industry that we discussed a bit earlier. So for example, marketing included things around price. So a retailer having a price discount or promotions that could then decrease the price of tobacco products, as well as promotions like branded displays of products. They also looked at things like the placement of products, so having products in your register, which means you're forced to see it, to potentially interact with it when you go. Placement also like that photo we saw earlier with the M&M guy right next to tobacco products. And then they also looked at product characteristics. So for example, the availability of flavored tobacco products, which have been found to be more appealing to youth. And so the author summarized 43 studies with 148 findings across 8 countries. And they found that there was greater tobacco marketing in lower income neighborhoods and those with more Black residents. They also found that there was more menthol tobacco product marketing in urban neighborhoods and those with more Black residents. And I want to talk a little bit more about this finding. So menthol cigarettes are the only flavored cigarette that are still on the market in the US. After they were exempted from the 2009 Tobacco Control Act that prohibited and banned all other flavored cigarettes. And menthol cigarettes have been shown to be more addictive and harmful than non-mentholated cigarettes because they can mask the harshness of smoking. And so this finding is especially concerning as the tobacco industry has a long history of specifically targeting menthol cigarettes to Black people and communities. And we can see this here with some of their historical ads that they've used. And today, more than 80% of Black people who smoke use menthol cigarettes. And so if you want to read more about this industry targeting, and again, those tactics and strategies that they used around menthol cigarettes, these are a few different papers that I recommend checking out. And then the final kind of main finding that the study found was that smokeless tobacco also seemed to be more targeted in rural neighborhoods where tobacco use and specifically smokeless rates are typically higher, in those neighborhoods with more white residents. So now we know that tobacco marketing and specific types of marketing for certain products are more prevalent in some types of neighborhoods. In the second study example, let's look at proximity or the actual residential distance that people live from tobacco retailers. So in this study, I looked at neighborhood, racial, ethnic, and socioeconomic inequities, again, and how close people live to tobacco retailers. I'm just going to touch on one of the findings today. So here's a map of Mecklenburg County, North Carolina, which is home to Charlotte. And so here's the whole county, and then these are census tracts, which are administrative boundaries used by the government. They try to have about 4,000 people living in these and typically have similar sociodemographic characteristics within. And so these are census tracts. I'm going to call them neighborhoods for our purposes. And so here's a map of tracts within Mecklenburg County, and I've mapped out the median household income of each of these tracts. So darker blue areas, which are kind of on the periphery of the county, indicate higher income, whereas lighter blue colors indicate lower median household income. And then here on the right is the distance residents in each of these neighborhoods or tracts are to a tobacco retailer. And so lighter blue here indicates that people are living closer to a tobacco retailer. And so what you see in comparing these two maps is that they look very similar to one another, where the colors are very similar in which it's darker on the outside and tends to be lighter on the inside. So this indicates that people living in lower income neighborhoods or in lighter colored areas here are living closer to tobacco retailers on average, while those living in higher income neighborhoods tend to live farther away from tobacco retailers. But we also know that people don't just shop at their nearest retailer. So we then calculated how close people were to multiple tobacco retailers, like 5 tobacco retailers or 10 tobacco retailers. And that's demonstrated here in this figure. So here's one residence, and typically we've measured in the field their distance to the nearest one tobacco retailer. But you may have a residence that's surrounded by many tobacco retailers, which you could think might differentially potentially influence their tobacco use behaviors or just exposure to marketing. And so what we did is we then followed the road networks and calculated the average distance of this residence to 10 tobacco retailers. And what we found is that residences and neighborhoods in the lowest income quintile were on average closer to 10 tobacco retailers than those residing in the highest income quintile were to just a single retailer. So a very large inequity here. So now we've seen how both inequities in the marketing of tobacco products and how close people actually live to tobacco retailers are being documented and demonstrated in the literature. The final study I'm going to talk about, I'm going to go into a little more depth than the first two, and it's focused on inequities in the actual concentration of tobacco retailers. And so tobacco retailer density is a measure of the availability of tobacco retailers within a geographic area. And one of the most common measures is the number of retailers per square mile in a neighborhood, like a census tract or maybe even a county. So here again, you could say here's a neighborhood, we have 2 tobacco retailers in it, so we get a retailer density of 2 retailers per square mile. Now, previous studies documenting inequities in tobacco retailer density have focused on studying associations within a neighborhood, or what I'm going to call a focal census tract. So for example, assessing whether the sociodemographic characteristics in this tract are associated with the retailer density within the same tract. But we know that characteristics of places surrounding any given area or neighborhood might also be relevant to the experiences, the behaviors, and the health of people living in that neighborhood. So perhaps it's not just a single focal tract that is a neighborhood, but we might also need to consider the neighboring areas around it and what those look like. And so the aim of this study was to identify whether sociodemographic compositions of census tracts surrounding a focal tract are associated with tobacco retailer density. The sample was across all of the US, so almost 72,000 census tracts, which again are administrative boundaries that are often used in research. They're a bit imperfect as proxies for neighborhoods, but are used because they can nicely be used over time. And so this is how we conceptualize the neighborhood for this study. The outcome variable here, again, is retailer density, which is the number of tobacco retailers per square mile in a census tract or neighborhood. The independent variables here are several different sociodemographic variables that I'll get into on the next slide. And then we also accounted for urbanicity and rurality. So the different neighborhood level or tract level sociodemographic characteristics we were interested in here were the percent reporting being non-Hispanic Black or African American, the percent reporting being non-Hispanic White. We also looked at the percent of residents in a neighborhood reporting being Hispanic or Latino. And then we had 3 different measures of socioeconomic status. So the first was looking at the percent of residents reporting living below 150% of the federal poverty level. We also looked at something called the Gini Index of Income Inequality. And so the Gini Index or coefficient ranges from 0, which means that all households in that neighborhood have the same income, so it's perfect equality, to 1, which means that there's perfect inequality, or that just a single household has all of the income in that neighborhood. And so the Gini Index helps us better capture kind of the distribution of household income within a tract. And then finally, we also looked at median household income of a tract. And so I use spatial econometric modeling, and specifically something called a spatial Durbin error model, which I'm going to break down for us. So again, say we have a neighborhood here, and what we've seen previous studies do is look at how the sociodemographic characteristics in this neighborhood are associated with the retailer density in this neighborhood. And I'm going to call that a direct or a focal effect. But this neighborhood also likely has at least one other neighbor, and for simplicity, we're just going to show 1. And this neighbor also has sociodemographic characteristics associated with it and a retailer density associated with it. And so earlier I talked about how we've seen how different racist policies and practices and discriminatory practices have resulted in the spatial stratification of people by their sociodemographic characteristics. So it seems reasonable then to think that sociodemographic characteristics would be correlated or similar between neighboring units. And so we see that here in these maps. And so what we did is we mapped out each of the neighborhood demographics separately and looked at this and calculated some spatial indicators of kind of clustering. But what you want to look at here, so for example, if we look at percent living in less than 150% of the federal poverty level, is you see certain areas we have darker colors clustered together, and in other areas we have lighter colors clustered together. And you see that kind of consistently through each of these tracks where you can make out darker pockets and also lighter pockets. So this is more evidence of segregation by different characteristics. So based on this then, we wanted to know about this indirect or neighbor effect. So in other words, are sociodemographic characteristics of a focal tract also associated with the retailer density and its neighbors? And so let's look at some results. We'll start with the percent of non-Hispanic Black residents. Here we see, just focusing within a tract, that there's a positive association here. So a higher percent Black in a neighborhood is associated with greater retailer density in a neighborhood. But we also see an indirect effect here. And so what we can conclude from here is that on average, a 10 percentage point increase in the Black population was associated with more retailers per square mile, both within a focal tract here, but also in its neighbors. And then we also found this for Hispanic or Latino population. So a 10 percentage point increase in the Hispanic or Latino population was associated with more retailers in a focal tract and in its neighbors. And then we found something inverse for percent white. So a 10 percentage point increase in the white population was associated with fewer retailers. So now we have a negative number here. So fewer retailers per square mile in a tract, and also fewer retailers in its neighbors. And then moving on to socioeconomic status. A 10 percentage point increase in the population living below 150% of the federal poverty line was associated with more retailers per square mile, again, both within the tract and in its neighbors. And then looking at the Gini income index of inequality, where remember a higher number means you have more income inequality. And so we found that a 0.1 point increase in the Gini income index of inequality was again associated with more retailers per square mile in a tract, and as well very strongly in its neighbors. And then we found an inverse association with looking at income. So a $10,000 increase in median household income was associated with fewer retailers per square mile within a focal tract and in its neighbors. So some study implications to kind of just wrap this up. So prior to this study, which used demographic data from 2018, the last national study to look at inequities in retailer density across all of the US used data from 2000. And so our study, almost 20 years later, is still documenting inequities at the neighborhood level. So there are persistent inequities in retailer density by neighborhood, race, ethnicity, and socioeconomic status. And we also found that inequities that don't account for these spatial processes, or that sociodemographics may be correlated across space, again, due to factors like residential segregation, these studies might actually be underestimating how large these inequities in retailer density really are. And then finally, from a policy perspective, we've decided that jurisdictions need to intentionally design equity into place-based tobacco control policies, and especially in areas that have experienced and are experiencing high racialized and economic segregation. So now we've seen through a few studies that there are stark inequities in both the neighborhood marketing of tobacco products and the availability of tobacco retailers. So what can we do about it from a policy perspective? So earlier I talked about the tobacco control vaccine and its 4 components that have helped decrease cigarette smoking and tobacco use over time. The vaccine, however, largely ignores the retailer environment, though, which we've now discussed is extremely important when we're thinking about tobacco use and also inequities. So I partnered up with one of the original authors of the tobacco control vaccine, and we wrote a paper that's linked here at the bottom that proposes a vaccine booster to the original tobacco control vaccine. And so this booster is specifically focused on 5 different retail strategies that could not just further reduce cigarette and tobacco use prevalence overall, but might actually do so equitably. And so these strategies center around product and retailer availability, pricing and promotion of products, tobacco product advertising, as well as thinking about display bans of the actual products, age of sale, and also retail licensure. And so today I'm going to touch on one more study about a policy that's centered on reducing the actual retailer availability or tobacco retailer availability. But you could think that many of these strategies will likely complement one another. So for example, by actually decreasing tobacco retailer availability or the number of retailers that sell tobacco products, you would theoretically also likely reduce tobacco product advertising. And to be able to do any of these policies, you need retail licensure, where you would require a tobacco retailer to pay a fee to have a license to sell tobacco. And that way, that system can work so we actually know where tobacco retailers are located. So I'll next briefly talk about one study that used a spatial simulation to look at the equity implications of one type of policy that could reduce tobacco retailer availability. And so the study question here was, what impact does a ban on tobacco sales in retailers within 1,000 feet of schools have on neighborhood, racial, and socioeconomic inequities in retailer density? And so this study took tobacco retailer licensing lists from both New York State and Missouri, and then geocoded or found the spatial locations of each or of all the tobacco retailers. They then mapped both public and private schools and created 1,000-foot buffers around these schools, which I'll show in a second. Our neighborhood sociodemographic characteristics here are defined again at the census tract level. And so what does this policy look like? So here you have a school, and what this policy is saying is there can be no tobacco retailers within 1,000 feet of the school. So there might be tobacco retailers outside of this buffer, but none of them can fall within. And so what did they find? So let's first look at neighborhood median household income. And so here we have the retailer density, which is the number of retailers per 1,000 people in a tract. And again, median household income. So on the left side of the chart, we have neighborhoods with the lowest median household income, and they have a retailer density of 1.28 retailers per 1,000 people. And then on the farthest or the far right of this graph, we have the highest income neighborhoods, and they have a retailer density of 0.84. And so before this policy is simulated, we see there's a big gap here or a big inequity. And so this is where neighborhoods with the lowest median household income had a retailer density of 0.44 more than neighborhoods with the highest income here. So pretty large gap. So what happens when you implement that 1,000-foot ban? What would you see? So what we see here is that this inequity basically disappears. So now the retailer density is just 0.36 in your lowest income neighborhoods, which is now lower actually than the density in the highest income neighborhoods. And then let's look at the projected impact on the percent of Black residents in a neighborhood. And so we see a very similar relationship here. So again, pre-ban, we have lowest percent Black neighborhoods have the lowest density at 0.75 retailers per 1,000 people. And then the highest percent Black neighborhoods have the highest density at 1.09. So we have an equity or a difference of 0.34. But then we see again, once this policy is implemented, that this inequity is no longer present. And again, it's actually lowest in neighborhoods with the highest percent Black. And so this is what we mean by a pro-equity policy. It's not just reducing exposure and availability overall for all neighborhoods, which we see that because it's lower than each one, but it's doing so more so in neighborhoods that have a disproportionate burden here, and that we can close that inequity. And so some other ways to reduce tobacco retailer density are listed here in this really nice graphic from Change Labs and Counter Tobacco. So for example, you could cap the number of retailers in a geographic area. So this was done actually in San Francisco, where they said there can be no more than 45 tobacco retailers within one of their districts. And then another popular one that has gotten a lot of attention in the last few years centers around pharmacies. So I think most of us would agree that pharmacies are seen as or should be health promoting retailers, and they really shouldn't sell tobacco products to begin with. And we've indeed seen some pharmacies, stop the sales like CVS in 2014. Importantly, though, some of these policies proposed here might actually unintentionally widen inequities. So for example, several studies now show that policies that restrict the sales of tobacco products in pharmacies might actually widen inequities because pharmacies tend to be located in more privileged areas to begin with. So we need to be mindful of what policies we are designing and implementing and recommending, and we need to do equity assessments to start. And these equity assessments may then inform us and tell us, okay, we actually need a combination of policies. So maybe it's prohibiting the sales of tobacco products in pharmacies, but it's also doing something like the school buffer, where you also don't allow tobacco retailers to sell tobacco products near a school. So I'll finally just wrap up with a few key takeaways. So hopefully today, in seeing all of this, we can agree that tobacco retailers are very abundant. They're ubiquitous, and there's ample tobacco product marketing at the point of sale. And we see that neighborhood inequities are persistent in both marketing and availability. We've also talked about today how tobacco retailer marketing, proximity, and density are associated now with tobacco use behaviors and related health outcomes. And so finally, this means that there are a variety of policy strategies that can be used to reduce retailer marketing and availability, but impacts on equity need consideration and should be prioritized from the start. And so thank you so much for tuning in and listening today. My contact information is listed here, and I look forward to the discussion and any questions that may come up.
Thank you, Amanda. If you can just leave your slide up, that would be great. Just, while we kind of look at the chat and see what people are saying and asking. Thank you so much for that enlightening presentation. It was great. Okay, so we have Tiffany Chavis saying it would be interesting to see the same data side by side with liquor stores.
Yeah, absolutely. So this is something I am trying to look into in some of my research now. So as I think Tiffany is alluding, liquor stores are also a health harming commodity. And we also know that alcohol is often sold alongside tobacco retailers. So earlier when I showed that slide of the different store types of tobacco retailers, many of those, like pharmacies, like supermarkets, are also selling alcohol and liquor. And there have been studies that look at inequities similar to tobacco and vice versa, tobacco learning from alcohol. And you also see these inequities persist. So yeah.
Thank you. Okay. When looking at race, were any other factors controlled for, or are all these examples looking specifically at race or SES or Gini?
Yep, so thank you for that question. So all of the associations I presented on today in that study are unadjusted associations. And I can talk a little bit about why we did that. So when you control for these other factors, which if you're not familiar, that means in the model, we're putting in all of those different demographic variables at the same time. So percent Black would have been in there, percent Hispanic and Latino would have been there, median household income would have been there, all of those different demographic characteristics. And when you do that, the way you're trying to interpret it is you're trying to control for the fact to isolate an association. So to think about that, I guess a little more simply, you would say in a neighborhood where everyone's income was the same, what would the association look like for percent Black? And so we chose in this study to actually only present unadjusted results. We did that for a couple of reasons. When you control and kind of create that counterfactual, you are not accounting for the fact that discriminatory processes by race and racialization also happen for economic segregation. And so a lot of studies, will put all these factors in and adjust for it and then say there's not an inequity there anymore. But it's because they've kind of created this counterfactual world where we've controlled away all the inequities that are actually present. And so that's why we decided to look at unadjusted effects so that we could better isolate what we're seeing there. The other reason we did this is because we have a near census or almost all neighborhoods in the US. So this again is more representative of what are we actually seeing on the ground and what inequities are there. And so that's why we decided to do unadjusted results and why we also looked at things like percent white to see, do we truly see an inverse association from what we would expect for percent Black or percent Hispanic or Latino, and why we also looked at, higher median household income, but also income inequality.
Thank you for that. And then the last question is, will the slides be made available? We can.
Yeah, I think we can probably do that.
Okay, we can send those out. All right. All right. Well, thank you everyone for coming to.
In April, I think we might have lost you. I don't hear you anymore.
Oh, sorry. Okay. Sorry, I'm talking to myself, right? Okay, can you hear me now?
Yes.
Okay, thank you. All right. Oh, thank you for that. Sorry. Oh, wait a minute, something else. You know what? Another question came up before. Okay, are there any lessons from other countries that have addressed successfully tobacco retailer marketing. Complete bans may be the most impactful policy, but it would be hard to sell in the US.
Yeah, so I think when you're saying complete bans, I think you're talking about complete bans on marketing and advertising. So in the US, of course, it's hard to try to implement a ban on advertising or marketing because of the Constitution. And so that's why, you know, one of the good ways, which I touched on a little bit to try to address that, is to actually think about reducing the actual supply of tobacco products. So if you can reduce the number of retailers that are selling tobacco products, you hopefully would theoretically then get at actual marketing of these products. Other countries where you can actually, you know, implement both marketing and advertising bans and even display bans where the products have to be behind the counter or they have to be in a shelving unit that you can't see, have gotten rid of marketing in some ways. But what we've actually seen the industry do is in some of these countries like Australia, is the industry now comes in and there's a pricing sheet that has all the different tobacco products since you can't see them. And the industry has then tried to incentivize retailers to put certain products higher up on that list or to list them in a certain way. And so I would just say, even when we try to get rid of marketing and advertising, whether that be in the US or in other countries, the industry is very smart and is very strategic with how they respond to that. And so trying to focus, I think, more broadly or first on these supply side interventions of how do we actually decrease the actual supply of tobacco products, I think is potentially a more impactful way to then get at marketing and advertising.
Okay, great. Thank you very much. Yeah, thank you again, you know, Dr. Kong, for coming in and doing this presentation for us.
Thank you.
It was, you know, very, very enlightening. Okay, so I've put, once again, I put the evaluation in the chat. Please be sure to fill out the evaluation because this is the way that you will receive credit for this webinar. And okay, I'm going to take the presenter thing back. Here we go. All right, and I'm going to share my screen, share a bit with you. The next webinar that we have coming up is with the Public Health Webinar Series. It's next Tuesday. I believe that's March 8th, 1 to 2 p.m. Eastern Time, and it's on transgender and gender non-binary sexual and reproductive health, featuring family nurse practitioner Miles Harris. And you can go to nnlm.gov/training to sign up for that webinar. All right, and if we have no more, okay. All right, it looks like we have no more questions, and we have shared everything. Thank you so much once again for everyone for coming, and thank you, Dr. Amanda Kong, for a fabulous presentation. And everyone have a great afternoon.
Thank you, everyone.
Bye-bye.